Welcome to the deep dive. Today, we're doing a quick, focused look at a really important little thing, ferritin.
That's right. Tiny protein, big job.
Yeah, it seems to dictate quite a lot about your energy. We're pulling our insights today straight from the sources provided by Blood Tests UK. They're the experts doing accessible testing over in Margate in Kent.
Exactly. And ferritin, well, put simply, it's basically your body's main iron storage house.
A storage house, okay.
Yeah, in the ferritin blood test, it measures how full that storage house actually is. It gives you the real picture of your iron reserves, the long-term view.
Right, okay. So if it's just about storage, why is checking ferritin often, better than just measuring the iron itself that's floating around?
Good question. That's really the core insight here. See, iron just floating free, it can actually be a bit toxic, causes something called oxidative stress.
Oh.
So the body is smart. It doesn't like free iron hanging about.
Right.
It locks it away safely inside this ferritin protein. So when we measure ferritin, we're not just looking for iron deficiency anemia.
Oh.
The thing that causes that awful fatigue people talk about.
Right, the low iron fatigue.
We're also looking for a couple of other really significant things.
Such as?
Well, first is the storage house completely overflowing. This can point towards iron overload disorders. The most common one is haemochromatosis.
And that's bad.
Oh, yeah. Very serious. If you store too much iron over time, it can actually damage your vital organs. We're talking liver, heart, pancreas.
Wow. Okay, so too little iron, you're exhausted. Too much iron, potentially organ damage. That's quite a range for one marker. What was the other thing it shows? You said there were two?
Yes, inflammation. And this is where it gets really interesting for listeners trying to understand their health better. Ferritin, it's what doctors call an acute phase reactant, meaning when your body is fighting something serious, like a bad infection or some kind of chronic inflammation, even things like liver disease, your ferritin levels can shoot way up. It's like a defense mechanism.
So high ferritin doesn't automatically mean you're loaded with iron.
Exactly. You could have really high ferritin readings, but actually still be iron deficient underneath. The inflammation is kind of artificially inflating that storage number.
That's tricky.
It is. And that's why the test is so useful. It can flag that hidden inflammation, sometimes way before you'd notice any other symptoms.
Okay, wow. So finding these kinds of imbalances early, whether it's too low, too high, or this inflammation signal, sounds absolutely critical. And that's where the accessibility piece comes in, right? Which is something the sources from Blood Tests UK really highlight.
Precisely. Knowing your ferritin status lets healthcare providers step in much earlier. Often the fixes are quite straightforward, maybe changes to your diet or specific supplements.
Yeah.
The sources really stress this. Catching these issues early is probably the biggest thing you can do to prevent serious problems down the line and, just feel better day to day, improve your quality of life.
Right. And let's get practical for a moment, especially for you listening, perhaps if you're in or around Margate. The materials we looked at, again, from Blood Test UK, they make it clear this isn't some complicated procedure.
Not at all. It's just a simple blood draw, usually from your arm, quick and easy.
And easy to get done locally.
Very much so, according to the source info. You can usually get this test done at places like Margate Health Center, Harbor Medical Practice, and also local NHS hospitals in the area. It's widely available. And considering what it tells you, it's pretty affordable too, usually somewhere between, say, 20 pounds and 50 pounds for the test itself.
That seems very reasonable for that level of insight. What about getting ready for it? Do you need to do anything special?
Preparation is usually minimal. You might need to fast for a few hours beforehand, but honestly, the best advice is always just check with whoever's doing the test. They'll tell you exactly what's needed.
Good advice. And you get the results back pretty quickly.
Yep, usually within a few days, maybe up to a week. No long, stressful wait.
Okay, so let's just quickly recap the power locked in this little protein then. A simple, affordable ferritin test. It can explain nagging fatigue, warn about dangerous iron buildup, and even act as this kind of subtle alarm bell for hidden inflammation.
It's a real workhorse test.
And checking it regularly, as Blood Tests UK points out in their materials, seems like a really smart part of looking after your health proactively.
Absolutely. And that brings up maybe a final thought for you, the listener, to chew on. Let's say you find out your iron stores are a bit low, and maybe you need to adjust your diet. What's one simple little lifestyle tweak you could explore starting today to help your body actually absorb iron better?
Like how you eat things.
Exactly. For instance, just making sure you have something rich in vitamin C like orange juice or some peppers alongside your iron-rich foods. That can dramatically boost how much iron your body actually takes in. A small change, potentially a huge win for your health.